for third.
Okay.
Well, hello.
Okay, I'm assuming that's a
How
yes.
is everyone? I'm just so glad to be here with you today. I'm having a little trouble with my camera, so bear with me. I hope you can see me okay here. And here, good morning, good afternoon, good night, wherever you are. This is Dr. Applewhite, and I'm coming to you from Mesa, Arizona. And we are getting ready to have the Differently Abled Network meeting. And I'm so happy to be here. I can't tell you um, how grateful I am to be alive today. It's just fantastic. How do you feel? How do you feel today? Kind of tap that into the chat. Do you feel good today? Do you feel fine? Are you anxious to hear about what we're going to talk about today? I hope so. We started the Differently Abled Network back in 2017, actually, as an official program of White Apple Institute. Excuse that camera movement there. The Differently Abled Network is an outreach program, but it's a little bit more than that. It's a mentorship and membership program also. Okay. And thank you. I hear from already a few people saying, I'm happy to be here this morning. That's right. Even though the subject is not the greatest subject in the world, we're going to get through it with learning a little bit more about each other and how to live successfully with disability, because that's really what this is all about, right? That's what the Differently Abled Network is. That's why we have all these educators and employers and business people and social workers that join us on the last Sunday of the month. That's when we have our Differently Abled Network meeting, or DAN, and we listen. We don't just listen, though. We take action. We take action. We try our best to get people out of their crises to prevent the instability that usually leads to, unfortunately, suicide ideations, suicide ideas, suicide thoughts, and completions, unfortunately. Okay. So we want to keep on keeping on with the Differently Abled Network. Today, we have the Ask Dr. Applewhite program, which is answering the question of how do I get through work after being diagnosed with cancer. Okay. And then we have our recognition award today. And we have our Voices from Veterans. Dr. Jane Garcia will be joining us from Reintegrate and talking about the transitional programs that she's putting together for women veterans. And of course, we end every program raising spirits and talking about how music and art can be a healing for all of us. So let's get started. Let me tell you a little bit about myself. You can learn more about me if you go on to the website. But I'm Dr. Applewhite. A lot of people call me Dr. Apple or Doc Apple. I'm the founder of White Apple Institute, and I'm also the host of the Differently Abled Network program. And I've been around doing this work for a long time. I'm 72, so figure it out. I started when I was 20-something years old. But I love it. I love this work. I love seeing people learning how to live successfully with disability as equals in our society. Myself, I became disabled in 2006 as a result of a major car accident. That has left me wheelchair bound but still with a smile on my face. Now, that doesn't mean every morning, because I'm a realist. Okay. I'm an optimist, but not too optimistic where I'm not real, and that I don't listen to you. So when you write me or you call me at 888-56-APPLE, that's our number. Write it down. 888-56-APPLE. That's 888-562-7753. And my friends, when you write me, and you can write me a question, you can write me a statement, ideas that you have about how we can help people live more successfully with disability, I'm open for it. Please, please. You see, I decided that I wanted to be a differently abled person. Okay. And it doesn't mean that I don't understand that I have disabilities. My goodness, no. Okay. But the negative perception of disabled was out there. And I said, no, I don't want that negative perception around me because I am differently able. I can still do many of the same things that I did before, just a different way. And then because I'm a teacher, I'm a retired professor, I want to teach others how to do it like that. Okay. So I decided I wanted to be a productive member of society and a contributing member, even though I could not walk, even though I myself dealt with cancer, which I'm going to talk about later, and tremendous issues with spinal cord injury. And I said, no, I'm going to focus on what I can do, not what I can't do. Can I, can I help you to learn that? Or maybe you already know it and you want to become a member of the Differently Able Network and help me help others to get that concept. Okay. So I've changed my perception from disabled to differently abled. And I'm having success helping other people to get into the workforce, into higher education, as well as to live successfully with disability. Does that explain it pretty well what we do? I hope so. So we thank our sponsors and our partners out there that have been helping us for some years now. We've got some great organizations out there that have just been doing a wonderful job. Um, let's give a real good some kudos to Interfaith Community because they were the first ones who opened their door and said, come on in and start this Differently Abled Network meeting. And East Valley Rise, Paralyzed Veterans of America, Disabled Veterans of America. And I cannot forget my sister agencies, Veterans First, Women's Army Corps, military women across the nation. There's just, I thank all of you for being part of a developing partnership. Okay, next slide. So where we are now is defining what is cancer. And from my own research, I found out some things that really kind of blew my mind. So I want to share them with you. And that is that 40 out of 100 men and women, okay, it's a little lower for 39 out of 100 women, but about 40 people out of 100. So imagine 100 people in the room and 40 of them will be diagnosed with cancer in their lifetime. Okay. And women are twice as likely to get it. That's pretty deep for me. Okay. And I see these commercials a lot. I don't know if you do, about children with cancer, but that's only 1% of the actual diagnosis. And of course, they're always talking about how Black or African American people have the highest death rate of whatever illness we're talking about out there. That's something that has to be counteracted, isn't it? Okay. But they say that the African American population has the shortest survival of any racial group as far as cancer is concerned. And there's a lot of different reasons for that I'm going to get into later. Okay. Hispanics, Asian Pacifics, they found in research that age is a major factor. But let me tell you what I found. I found that stress is number one. Age is there, okay? But you get stress out of the way in your life and begin doing some of the things that we're going to talk about today as far as eating correctly. You already know all of it, okay? So next slide. Here is where I really want to bring in my guest speaker for today because she's online and she's been having some problems this morning and still landed up calling in this morning. And I think she's there. It's Miss L online. Miss L is there. Okay. I think she's there. Oh, okay. Okay. I'll try to stop shaking the camera. Let me see if I can put the camera a certain way here where it doesn't shake because I'm actually holding it, which makes it worse for me. What about that? Let me take a moment to do that. Is that okay? How's that look? Yes, that's better? Okay. All right. What was I? Okay, so I was bringing on Miss L to talk about cancer and what it is, and also how it's affected her life. Okay. Um, so our special guest this month, and let me tell you why I have to call her Miss L. Um, she is anonymous. She has gone through some very, very major things in her life, where we have to keep her anonymous right now. And so I hope that you can still get the gist of what she's going to share with us today as a uh, beyond cancer survivor to me, because this woman has dealt with so much. Okay, next slide. I want to oh, I'm sorry, go back for a minute. Go back for a minute. I wanted to introduce everybody else. Okay. Back again. Yeah, there you go. Okay. I wanted to tell you about Roberta Rodriguez. She's 39 years old, and she has teenage daughters, and she's a restaurant owner. She wrote in about basically the same thing. You know, how do I go to work now after being diagnosed with cancer? Again, she had uterine cancer about 10 years ago, and now she's coming back in and has cancer again, breast wise. So it comes back again. And I think Miss L is going to talk a little bit about that when we start. Wazi is another one I want to introduce you to. Of course, I don't use their real names unless they really want me to do that. But Wazi is a postal worker, and that's not so important as the factor that at least for him, there's insurance. That's why I wanted to emphasize that, and I'm gonna tie that back around again later. But he's dealing with prostate cancer and suicidal ideations. And then there's this lady named Danita Applewhite, which is me. And unfortunately, I have dealt with chronic, still dealing with chronic kidney disease, but I had renal cancer. And as we go along in conversation with Miss L, and the rest of you that are online today, will bring out more about this issue of cancer and suicidal thoughts. Okay, let me make a note here that and I have to read it to you legally, that we're like White Apple Institute is a nonprofit, and we want you to make sure, let me just sum it up right now, just make sure you talk to your medical professional, your primary care physician, your doctor, medical doctor, before you engage in any of the things that you might hear on our program. Okay, because we don't want you to do something that would harm you. Okay. All right, so since I've got that going, Lori, I'm going to talk a little bit about these people. Lori Elward, our producer for the differently abled artists and musicians. Lori, feel free to come in and jump in anytime you want to. Morgan, please. Okay, but I want to tell you, Miss L, are you there?
Miss L is currently not here
I
yet.
was trying to give her enough time to get on. Okay, I'll wait just a minute before see if she could come on again. But let me tell you a little bit about what Roberta was facing. Basically, she was facing choices. Okay, and that's what I encourage most people to do, is to face choices. Okay, the choice of surgery, the choice of treatment, the choice of what types of medications, chemotherapy that we're going to get into. And so she made choices, and that was something that we've got to give her great kudos for. Next slide. Now, on the other hand, when we talk about why does cancer kill so many people, this is what kind of depressed Wazi, okay? When he was learning more about cancer, one of the things that bothered him is the fact that many cancers are not detected until they're metastasized. In other words, they have gone throughout the body. And he just felt helpless. He felt hopeless. Okay. Um, there's a lot of reasons why cancer is still around and killing so many people. Um, the biggest thing, and I bet you guys know it, is the pharmaceutical companies. They have a rule over the government. They have a rule over the government, basically private over profit over private and profit over government. I say private and profit over people. Okay, next slide. Is Miss L in yet? Okay, is she here yet? Okay. So one of the things that Wazi came up with, and the reason why I'm hitting on him so much is because we landed up losing him. We landed up losing him. And I say that because I feel a loss. Okay. Um, and one of the reasons why we wanted to do this particular program today is in honor of his life and the factor that he did not want to deal with the cancer and the choices that were available to him. Okay. So another thing happened, and you might want to share this with someone in your life, whether they're an African American male or not. They have prostate cancer, is the factor of erectile dysfunction. Okay. Well, one of the things was he said, basically, if I can't get it up, there is no life for me. And unfortunately, his wife left him, which was another thing that happened. So as you see, there were a lot of things that were going on in his life at one time that kind of crushed his spirit. And we don't want that to happen to anyone out there. So why do I want you to focus on telling somebody about erectile dysfunction? I want you to tell them this. I want you to tell them that there's still life. Even if their penis is dysfunctional, there's still life. Learn different ways to satisfy your partner. Okay, you don't have to give up. And so many men do because of the prostate cancer issue. Okay, next slide. And is Miss L here yet? Okay, all right, because I'm going to stop here and I'm going to let members of the Differently Able Network help me out here with this one. Okay, basically, we're going to talk about ways to prevent cancer. Okay, and we're going to talk about dealing with the diagnosis, and we're going to talk about managing the fear. Managing the fear. Yeah. Because those are the three things that I've come across as Dr. Applewhite, as one who has been involved with vocational rehabilitation for many, many years and getting people into the workforce. These are some of the things that happen with every disability. It's not just cancer. You know, how do I prevent heart disease? How do I deal with the diagnosis of multiple sclerosis, of Parkinson's disease? You know, can I still go to work? How do I manage my fear? You know, any comments on that from our audience, our Differently Able Network members?
I would
Because I've
just
said a lot.
I would just like to mention,
And I'd like to hear if anybody else has been dealing with cancer or knows someone who's been dealing with cancer and they'd like to share.
can you hear me, Danita? Dr. Apple?
Lori, I can hear you.
Okay.
Well, I'd like to ask another question then. How about how young what about cancer when you're young? Does anybody have a fear of that?
I would jump in and say
Morgan?
for
Wait,
sure.
did you have your hand up?
Yeah, I definitely feel like that fear.
Okay, I'm just going to keep on moving on then. Next slide. Okay. Okay. Somebody's saying I'm trying to talk to you, but you can't hear me. Let me see what's going on here. Okay. Okay. I do have a lot in the chat box, and I'm probably well, you guys know I'm not technically sound. Okay, so I'm going to try to figure out what's going on here. So I cannot seem to see anybody. Okay. Am I okay? Hello? Can you see me now?
I can see you. Can you hear
Yep,
me?
I can see you. Can you
Okay,
hear us?
back to meeting. Okay, is what's wrong that the camera is the wrong way?
Nope, nope, we can see you just fine. It's just that
Okay,
you can't
let me
hear
see
us.
if I can get this right here. Okay, sorry about this. Okay, now do you have me now? Okay, now maybe I can hear you. So you mean to tell me all this time you haven't been able to see me?
No, we've been
Okay,
able to see
all right,
you. We just
that's okay.
we can't see you now. Can you
Nobody
hear
came
us?
in to tell me anything, so I'm just moving right along here. Okay. And Miss L, I thought I did see Miss L in the
I am communicating with her through text, so we'll see what happens here. Technical difficulties.
Okay, yeah. Mavis, if you're on, could you let Dr. Apple know that we have been able to hear her? We can see her just fine. She's just unable to hear us. And can you also please let her know that if she's talking to the group right now, we can't hear her. She is muted. If you could let her know that.
all right. The host wants to speak with me.
Yep,
Can you
Okay, I
hear?
just got something crazy here.
you
Okay.
were just
Hello, can you hear
muted.
me now?
We can hear you now. Yes. Can you hear us?
All right. So
She can't hear
express your
us.
reality. That's what I found is the most important thing to do, is to express our reality about how we feel going through the process. Okay. Um, Obviously, any diagnosis is going to bring on some fear, depression, anger, and a sense of loss of control. And you know, the hardest thing is the spiritual part of it. Many people are into that why me. We did a whole program on that once with Dan, of the why me, of people feeling that uh, no, I don't hear you at all. Okay, and I don't know why I don't hear you. Okay, one moment. Okay, I don't know why I can't hear any of you right now, but we'll just have to keep moving on because I just don't know what it is. And Morgan, yes, your co-host, would you try to figure that out from a technical end? Because I have no idea. So I'm sorry I can't get all of your comments in right now. I know you're eager to share, so we'll keep on moving until we can figure out the problem. Okay. But anyway, what I did is I established a routine. Okay. When I started dealing with the diagnosis of cancer, and I tell most people to do the same thing, is to make sure that they um, uh, deal with the diagnosis in a way of establishing a routine, like a daily schedule. Okay. Um, they're telling me that's my phone, that the reason why they can't hear me, and I just don't know what's going on with my phone. So um, I wanna say I also, when I was dealing with the diagnosis, I tried to make sure that I controlled the narrative in my head, you know, those voices the things that people can tell you that can make you feel really, really bad. And you decide, you decide yourself who you want to tell your business to. And be careful, especially on the job. I always tell people that, okay? Careful on the job who you talk to. Uh,
Uh,
follow.
follow.
I guess the
I
best way
guess the
to know
best way to
that
know
is
that
your
is your
intention. What
intention.
is your
What is your
intention?
intention?
Why are you
Why are you
sharing
sharing
information
information
about your
about your
cancer or your
cancer
heart
or your heart
disease or your
disease or your
or your
or your
MS
MS?
or your diabetes? Okay, why do you feel the necessity to share that with someone else? What are you looking for? Okay, so always examine that intention. That's a really good part. Okay, so dealing with the diagnosis. What's the next one? We want to talk about how to manage the fear. Okay, now I know for sure that there's a lot of fear that's associated with just the big C word. And when I was growing up, it was like horrible. You know, now it's a little bit better because there's a lot of therapeutic uh, success, a lot of success in therapy, success in treatment. And we found ways to manage the cancer, as Miss L, our guest, was going to share with you, is that she's herself is on an experimental program, experimental drug. Costs a lot of money, a lot of money. That's another thing dealing with the issues of cancer or any disability. Um, is the cost involved in the fact if you have to take time off of work. She had to take off a little over a year and landed up with having to find another job. Now, sometimes that happens, sometimes that doesn't happen. It just depends on the situation. In her situation, her job was way too stressful for her to go back to. Okay. But most of the time, under something called the Family Medical Leave Act, your job is held for you. Okay. And you can go back basically in the same position. Okay. So I'm going to read you some of the text messages that are coming in on this subject because I can't get any audio here. And like I said, I don't know why, but just bear with me. Someone is writing in that, yes, I had cancer and had a lumpectomy in 2013. That's taking out the lump that was in her breast. And also was told that she had congestive heart failure in 2020. However, I did not accept that, what they pronounced over me. And I've had no symptoms. Well, God bless you. That's wonderful. My faith in God has healed me and kept me safe. And that's great. Fantastic. Thank you so much for sharing that. Okay. Great, great stories that come in about people succeeding. And we can live with disability because, doggone it, my friends, that's what life is. We're gonna deal with the disses in our life. Even though we can kick the mess out of them, I kick the mess out of dis-ease, discomfort, disability. Okay, but the point is that I still recognize that they're there. They're part of life, and I ride that wave. Basically, it's a wave. One of my friends, I call her my spiritual daughter. She is the one who helped me to understand the waves in my life, how the ocean waves. I love to float in water. And one of the things that I do when I'm doing that is I manage fearful things that come up for me, and they come up for all of us. Thank you so much for again sharing. Let me see if there's another chat that I can share with you very, very quickly before I go back to finding your spiritual meaning when you're managing fear. Okay, because that's real important too. Um, let's see if I can get another chat in here. Okay, and we have another chat. We have a lot of them telling me that I'm muted. And my camera's shaking. That is for sure. I know that this is not the greatest podcast today, but we're doing the best we can. Okay. Um, oh gosh, somebody says yes, and we welcome the tides. We welcome the tides of life. And actually, that's one of our ASU students that's saying that. We're so proud to have a lot of students here from Arizona State University that are online with us today. It's really beautiful. So let's talk about the spiritual meaning of managing our fear, because um, I came up with something called spiritual distress. There's my dis again. Okay. It is normal to question the meaning of life. People have a problem with that. It's like, oh, I'm not supposed to ask the question of why me. Yeah, you can ask why me. You can ask why not me also. Um, Many people feel abandoned by their higher power, whatever they call God. Okay. Whether there is a God in their life, period. Whatever the creation is, whatever that energy is, many times they feel that there's this illness is like a punishment, and that they've done something wrong in their life. And we certainly don't want to promote that idea, but it's there. And so address it. Address it in the fact that, like I said to you earlier, express your reality. If you're feeling that, express it, but express it to the right people that are going to make you feel better. I feel that there's three ways we meet people, my friends. Okay. We either meet them and they make us feel the same when they leave us as when they came. Some make us feel worse. Some make us feel better. The ones that make us feel better, we want to come back again. The ones that make you feel worse, think about that, whether you want them in your life anymore. Three ways that we interact with each other. Okay? So, in this spiritual distress, my friend, Dr. Jane Garcia, who you'll hear in just a moment, come on and talk a little bit about what's going on with veterans out there, with our fellow veterans. She gave me this thing about No Stress Express. Jump on the No Stress Express when you feel it overwhelming you. Okay. But here's what I'm going to add a little bit more to it. If Dr. Jane is listening right now, I'm going to add that you have to be the person, we have to be the persons to figure out the depart date. When are you going to get on the No Stress Express? Okay. Or are you going to stay in the chaos? Okay. It's all right to sit on that pity pot for a minute. Okay. For a minute. Now roll up your sleeves and let's get going with life, because we are not going to let a disability define who we are. Okay? All right. Get grounded. I get grounded every day. I take my dog for a walk, and I take my sandals off and put my feet in the grass to get the electromagnetic energy that's in the earth. Okay? Very good. Very good feeling. Grounded. But there's another type of grounding, and that's connecting with art and music, which is what we're going to talk about later. And practicing mindfulness is a really good way to manage your fear. Learn about that. Just Google it. Google it and start looking for things that are going to help you, like Roberta, the one I mentioned earlier. That's what she did. She just sat down and said, I'm going to research this. I'm going to figure out how I can live successfully like this. Okay, next slide. So what are we doing here? Okay, what types of accommodations are needed for the workforce? Now, I really want to get into this a little bit deeper for those of you that have any questions. Does anybody have a question, or has anybody heard a question about what types of problems people run into asking for accommodations? Or do you even know what an accommodation is? Anybody? Anybody want to speak up and let me know? Does anybody know what an accommodation is in the first place? Would you like me to explain it?
Can you hear us
Okay.
if we
And
try to
yeah, I
talk?
understand. That's right. You said the voice, gosh, the sound is not coming through. Try to
Yes.
see if you can chat me. Okay. And I'll go ahead and read it. Anyway, letting you know, cancer is considered a disability under law, under federal law. Okay. So you've got your state law and your federal law. State laws run a little bit differently, but they still have to follow the federal guidelines. Okay. Cancer patients, especially cancer patients, okay, usually do continue working with a cancer diagnosis at the beginning, okay? And they are protected by the laws. We fought hard for the Americans with Disabilities Act. We fought hard for the Rehabilitation Act. And we fought hard for the Family Medical Leave Act. And don't forget, even under all these laws, there's the Pregnancy Workers Protection Act. Okay, so all of these things protect us at work and allow us to ask the employer for accommodations. Now, get this, when you ask the employer for an accommodation, and let me just make this real simple, just in case anybody doesn't know what an accommodation is. You see, I wear eyeglasses. I wear eyeglasses because I have a dis in my ability to see. Okay? Did you get that? All right. Now, if I put my glasses on, which become an accommodation, then I'm able to see better, right? Well, that goes with every accommodation that you have. You're able to do your work and come up to the productivity level that the employer expects of you. Now, I know some of you are saying, Dr. Applewhite, don't tell me. I got to tell my employer that I'm not feeling well today. They've got to understand. They've got to care about me. They do not on that level. They care about the one thing that's important for them to keep their jobs and their businesses running. And that is one word that you must remember, and that is productivity. So you must maintain your productivity when they give you an accommodation on the job. You must maintain the same identical performance that you have been doing all the time. If you do not, that is their reason for terminating you. Yes, it is. Yes, it is. They can terminate you very easily for a lack of productivity. Okay. And so you have to be careful of not only how you ask for accommodations and not disclosing the details of your disability. You do not have to do that. If you have a problem about how to advocate for yourself in that way, the only thing you have to do is call White Apple Institute, ask for a differently able network member, and we'll get on the phone with you and we'll talk to you about what's going on. Okay. And most of the time, 15 minutes you get free. And the rest of it, we charge a little nominal rate for people calling in to us. Um, and if you can't pay that, we have a hardship. So there's no reason why you can't research and find out things about the law and how they protect you. Okay. And we're moving right along here to the next slide. And we're talking about the Dan Member of the Month. Is she here? Is Reverend Rebecca Miller online? I didn't see her online. Um, we'll probably have to go to her next month. I've not heard from her. So would you skip over that slide? Okay. You know who we have now. Most of you wait for her. Okay. She is the wonderful Dr. Jane Garcia, and she is coming to us to share voices from our veterans. She will speak with us about some of the things that um, cancer in itself is kind of like a little different for our fellow veterans than it is for civilians. Okay. Why? Okay. Well, let's figure it out. Next slide.
Good morning,
Okay.
everybody.
So the role of stress in veterans' life. Hello, Dr. Jane, beautiful woman. How are you?
I am amazing. How are you all doing?
And unfortunately, I cannot hear you. Okay.
Um,
So
how
I
about
am
now?
going
Can you hear me?
to I'm going to let you
Dr. Jane,
speak
we can hear you. I think it's
about the
something on
slide that's
Apple's end,
showing now.
Dr. Apple's end.
Okay.
Just so you know, everyone else can
And
hear you.
then I am going to, while you're doing that, I am going to try to figure out how I can unmute you for me. Um, would you please let me know, Morgan, whether or not you can hear Dr. Jane? Okay. All right. Because that will be a problem if the audience can't hear. Okay.
No, she
All
can
right.
hear me.
So go ahead, Dr. Jane.
Okay. Hi,
Welcome.
everyone. Thank you for having me. When we talk about stress, there is this high, low, and just the perfect level of stress that we have to have, right? There's this sweet spot. And if we're existing in this sweet spot, then we're good, right? Now, if we are on the other end of the spectrum where it's constantly high stress, low stress, and so forth, in this high stress space, we become unproductive but that is also where we see a lot of the health challenges that come into place, both physical health challenges as well as mental health challenges. Um, because then I want you guys to think about, in our nervous system and when we're in flight, fight, or freeze, right? Um, when our nervous system kicks in, it kicks in as a measure or a way of protection. Once whatever that danger is passes, it resets to our normal state. When we're in a place of constant or elevated stress, then it
I can't
stays
hear my.
kicked in. It stays kicked in. And once it stays kicked in, this is where we begin to experience, or people begin to experience high blood pressure, PTSD, and so forth, because we were never meant as human beings to exist in a state of elevated um, arousal, right? Stress response arousal. We're not meant to exist in that state. And so when you have a person who have a diagnosis, a cancer diagnosis, regardless of the type of cancer, um, then there is a challenge of, okay, how am I going to deal with that? What am I going to do? So one is the physical aspect, and the management of the disease. The other piece is the management of life. How am I going to pay my bills, my expenses? What does my insurance cover? And so there is that piece. Then there is the piece of my family. How is my family going to deal with me? Are they going to properly take care of me in this time of poor health? And so I look at it as it's like three big buckets, right? As big buckets. So me, the individual, and the management of my illness, my financial responsibility obligation, so that life stuff. And then the other part is my familial relationships. Okay. Um, so in those various spaces, that's a lot. That's a lot for a person to deal with. And so therein where we see now, okay, what is going to be the physiological impact of this disease?
Mhm.
As I am dealing with this disease, am I going to beat it? Um, what is the toll? In the case for women, breast cancer,
Mhm.
are they going to keep their breasts or will they have to get a mastectomy? And then it goes into, okay, if they're a married person, what is that going to look like? Am I going to continue to have a spouse? And so forth. Right.
Mhm.
And so there are just various aspects of it. I'm sorry, I didn't have my phone next to
You know,
me.
I want to piggyback on that for a minute because I don't know if you were around when I was talking about a gentleman by the name of Wazi, um, and he contracted prostate cancer. And unfortunately, he did die by suicide. But before he did that, there were a number of sessions that we had together where we were discussing why he felt so uncomfortable about that, and it was the erectile dysfunction issue, the sexuality in his life that so many men unfortunately focus on, and that's one of the major reasons that kind of pushed him over the edge. So I'm glad you brought that out, even from the military perspective.
I was on mute, so I was talking to myself.
That's okay. Go
As
ahead.
we um are talking about these issues,
Yes.
for us as veterans, and as women veterans, um, there's some things that are salient across the board, right?
Yes.
Um, and so it goes across regardless of what our status is. But in terms of us being veterans, um, as we existed in the military under this constant um,
Stress.
elevated
Stress.
stress,
Yeah.
you know,
That's what it
for
is.
years on top of years, you
Yes.
know, it brings a different, or an elevated, um, stress management tool to the situation,
And from my
right?
understanding, and if I remember correctly, Dr. Jane, with your company, Reintegrate, you have a component in your program that pretty much addresses that. Hmm.
Yes. Um, because here's the thing. As we are making this transition, it takes a solid 10 to 15 years for someone to say they have made that transition from a service member to a civilian,
Wow.
right? It's a journey
No matter how
because
much
we
time they've served?
no,
Right. Because it
no,
embeds. I remember basic training being
yeah,
it was so embedded to be that superwoman, that having any type of disability even in my life was like terrifying to me. No, I'm not. I am strong.
right. And so they're approaching treatment that way.
Mm,
And if their threshold for pain is high.
mm-hmm.
And so um things may be happening, and because of the pride too,
Yes.
like I said, veterans are an arrogant bunch.
You say that and I always laugh when you say that, but I mean I have to agree that's there.
you know and so even if they're feeling pain, they're not going to say they are in pain,
Well, I'm one of the they.
right?
I'm one of the they. Yes. Yes.
And so if you're not expressing the pain, no, you're not treated properly. That's one. Two, sh- pain increases our heartbeat and our stress
Yes.
levels. So if you're not talking about the pain that you're experiencing, there we go with these elevated blood pressure because
Right.
you're in pain
The
and you're not
elevated stress levels,
expressing.
and I said earlier, express your reality. Express
Yes.
the reality of what you're feeling, even from a spiritual standpoint. If you're feeling like you've been left and to die or being punished by your creator or God, whatever, you need to express that to the right people, right?
Yes. And you got to do that. And so part of the process for us in Reintegrate is helping that woman find her voice,
Mm,
because then you must be able to articulate, I am in pain right now. My pain level is such and such.
hmm.
I need help to go to the grocery store. I need
Yeah.
help for someone to cook for me. No, I'll figure it out. I got it. No, 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 no. Because then in trying to figure it out and, oh, I got it, it takes us longer to get things
Right.
done.
Yes.
And so it takes longer for the healing process to happen
Ah,
because we're
the vicious
trying
cycle.
to, yeah,
Yes.
we're trying to do it all. And there we go.
Vicious cycle of trying to do it, then you fall or you hurt yourself more, or whatever. We ignore. When we looked at a lot of veterans from Agent Orange, they had truly ignored a lot of the symptoms, okay, that were going on. And I know that for sure. I did not know that I had cancer. I didn't have any problems with my kidney, and that's because I have to admit I was going so fast in life, okay? and popping pills and drinking sugary drinks and eating a lot of red meat and doing all those things that contribute to chronic kidney disease,
Yes.
you know?
You know,
Choice.
choices. And so one of the, I think in terms of, um, and we've talked about this before, but it's going to hit different.
Okay.
See, remember I talked about this idea or concept of a greedy institution.
Mm-hmm.
Um, in psychology, we use that term for military, law enforcement, firefighters. We consider those to be greedy institution because they take all of who we are.
Mm-hmm.
And there's a level of commitment that goes with being in those profession.
Mm-hmm.
And they're asking you to commit all of it, including your life.
Yeah.
And so in saying that, we do not want to say, oh, I don't feel well, because then I am no longer able to be a functioning
Ooh.
100% functioning member of the team.
And
Because now,
that's the underlying law. It's like an unwritten law that you don't do that.
yes, right? But
For
we
the men
have to
and
do
the
that.
women.
Yes.
Right.
The other piece is placing ourselves first. It's like
Yes.
when you're on the airplane and they say, put on your
Come on with it.
first,
Come on with it. There you go.
and
Put on the
then you
air
can
mask.
help everybody else or someone else. And so when this individual, this veteran is now the patient,
Yes.
it is hard for them to be the patient
Hmm.
and to be a patient,
Ooh, yes. Oh, that's so hard. So
right?
hard. Yes.
And they don't have patience with themselves, and they don't have patience with the healing process.
Hmm. Hmm.
They don't have patience with the medical system and how it's should function at that time. And so we have to learn to make ourselves a priority, because in those types of organizations, because they are greedy institutions, we are taught to make decisions based on the long-term interest of the
Hmm.
group, not the
Ooh.
whole.
And you can definitely make that applicable to the pharmaceutical industry. Okay. All right. Even from a military perspective, but I mean, most of the time we do use generic
Mhm.
treatments, generic drugs. Okay, because of the cost factor. Okay, so the military can do that, but when you're talking about civilian and like the lady that we were going to have on today, Miss L, her treatments are $21,000 every few months. She has totally ruined her financial status.
Financially,
Hmm.
right? And
Yeah.
so, how do you recover from that? Right?
Mm.
And so, these are the concerns that people have. So, they don't complain about the pain, and then the pain grows into something else because it wasn't addressed in the very beginning. And now
So
it's
what I hear you
exacerbating.
saying, let me see if I can sum this up before we move on to our differently abled artists and musicians. Um, we need to look at it from a physiological standpoint,
Yes.
brought out. We need to look at it from a mental standpoint, um, emotional and spiritual
Yes.
and financial.
Mhm.
That's five different
Domains.
segments of our
Yeah.
life that we have to look at with every disability that we have.
Yes.
Wow.
Yes.
And so we wonder why people die by suicide. We wonder why they do this is because they don't have the knowledge that we're sharing with them right now. And when they go to the doctor, it's very cut and dry, and there's no one listening. And we need to listen to each other. So this is why the Differently Abled Network is so important. Go to the next slide for a minute so we can get Dr. Jane to help us close up on some of
Mm.
the factors of the other risk factors, and I brought them out. I didn't want to go into reproductive history too much because if you have a if you're delayed on your first birth, there's a possibility of you being vulnerable to cancer. But I wanted to focus on more the toxic and environmental exposures, Dr. Jane. Um, if you could look at our slide for a minute, you can see the first one there. One of the cited factors, exposure to burn pits. I mean, you've heard of this just like I have with working with the veterans you have worked with. A lot of compounds, we're exposed to all of these things, okay? And they hurt us. And a
Yes.
lot of times we're not willing to admit, as you said earlier, about the pain.
Um, Here's the thing with toxic exposure.
Okay.
Um, Sometimes there's a delayed onset and
Mm-hmm.
delayed manifestation.
Okay.
Because what happens, it has to become a part of the cells and
Mm-hmm.
then build in that. And so as it becomes a part of our cellular function, that's, our cells and then become a part of the cellular function, it takes a while before that can actually be measured,
Mm. Yes.
right?
The slides
It's
will pop up. Sorry to interrupt. The slides are about
Oh
to pop
no.
up again. We're doing a transfer.
Yeah.
Okay.
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 Um,
Any comments so far on what we've been talking about? Because we've got a number of people who have been chatting in. Dr. Jane, we had some problems earlier with my sound issues, so I couldn't hear anybody, and they couldn't hear me. Um, would you please, whoever was trying to talk and raise their hand during that time, can you please give us some comment back to Dr. Jane and myself about all the things that we talked about today? I'd like to know how you feel. Those of you that are on the call this morning.
I mean, I'll jump in real quick. I think it's been very informative. My dad was diagnosed with cancer a couple years ago. It was very hard for him. He also had to work during it to see not just the physical, obviously, toll it took on his body, but the mental was just incredibly impactful for me. I almost felt
Mm.
like I was just very, I mean, I would say even now he's cancer free. It's been a couple years, but the long-lasting effects have really been mentally. Being, able to accept himself the way he is now and kind of mourn the loss of who he was before
Oh,
he had
wow.
cancer, what he even looked like. It's been very challenging for him now, but it's been very eye-opening to me just because it's all of a sudden it's like now that he's had it and he's my dad, I see and I hear about so many other people now. It was almost like a domino effect. It's almost like when you get a new car
Yeah.
and then you start seeing that car everywhere on the road.
Yeah.
But
Yeah.
cancer, it's just so unfortunately common, as we talked about in the beginning of this show here. So I think this has all been just really informative, and I am excited even just to share what we've discussed to my dad himself.
Thank you. And I'm glad to hear that you've been truly listening to what we've been saying today, as you always do. Um, I just wanted to congratulate you on being a very, very young woman, and having the empathy and compassion that you do for your dad and for others who have cancer. Thank you for joining us today.
Thank you.
Okay, anyone else that has a comment, a summary of what we've talked about today that would like to share their feelings about cancer or any other disability?
I shared in the chat, but I will share it again. My mother allowed the fear to be so great that she didn't go to the doctor. And she
Oh,
waited and waited and waited. And eventually it got to the point where she went, and there were some other factors involved, but she just put it off and she waited too long. So what could have been fairly minor was then major because the fear won. And, it's understandable how that can happen, but I just want to kind of encourage people that if you suspect something, it would be better to go and find out it's nothing than to go and find out you're too late to take care of it. So that'd be really important. And the other thing is that my daughter is a vet and she has had thyroid cancer and then about 10 years later, breast cancer.
Oh,
And
wow.
both times she has caught it early, gone and gotten the treatment she wanted to, and was able to afford that treatment, fortunately, and get what she needed. And she's doing really, really well. And
Great.
her story I mean, compared to other people, her route, we call it cancer light as a joke,
Yeah.
because, but that's in part because she was paying attention and doing breast exams and
Yes.
doing the things she needed to do, and she was able to find it. So
God,
that's
can we get her message out? Because it is so important that screening process, and they talk about it a lot. They have a few commercials out there on it. Wish they had more on how important it is. As a matter of fact, that's on our slide right now.
yeah.
After we talk about the high mortality, and I think Dr. Jane even mentioned something about the nervous system and cancer with traumatic brain injury. Then the increased screening is so important. And let's finalize this at the very bottom of this slide. It says, while the link between military related stress and cancer is a growing area of study, it is generally viewed as part of a complex set of risks that includes unique occupational hazards and life
Life
experiences.
experiences. And
Okay?
and and so that is that's a good final thought. And
Hmm.
so in terms of call to action, um, we talked about the screening. Please do your screening. As veterans, become a part of the VA healthcare system, so that you can go to those screenings. And when you have your appointments, go to your appointments. We as veterans are very fortunate to be able to have the VA healthcare. And
Yes.
for some people, there may be a cost. Yes. But for some people, there is not a cost.
Mhm.
And whatever it is that we have to pay, if we have to pay anything, it's
Very
still
low.
not compared, yeah, to
Mhm.
what the civilians have to pay.
Right.
And so you have your appointments, go to your appointments, develop relationships with your providers, whether it's your, general prac, your psychiatrist, your therapist, and so forth. Develop that relationship with them. Make yourself a priority. And I think that's a big thing. We
Yes.
have to learn. That's the whole relearning thing. We have to
Yes.
learn to make ourselves a priority so
Stay
that
in.
yeah, go to appointments and so forth. And then I think the final big piece is that remembering that if we are not well, we cannot do for anyone else.
Right.
And
Right.
so, in making
That's back to
ourselves,
right. Back to the air mask. Right.
yeah, instead
Back
of,
to the air mask. Hmm.
exactly. So, we make ourselves a priority so that we can care for others.
Yeah.
If we don't make ourselves a priority, we cannot take care of ourselves or others.
I love you, Dr. Jane. Thank you so much for being here this morning and sharing a little bit more about what Reintegrate is doing. And the reason why we really appreciate promoting Reintegrate is because they are the sponsor of one of our very special programs, the Place Your Bets on our Women Bets program. And that's where we specifically, any money raised for women veterans, we that goes into that particular program specifically for women veterans. And then other monies that we raise go into the differently abled network to help people when they are dealing with crisis, especially if they have a job interview or a critical exam or something and they need to get there, they can't find funding anywhere else, and they don't have a support system. Please make sure to write the number down, somewhere save whiteappleinstitute.org. Okay. And the number 888-56 apple. Okay. Now we get to the exciting part of our show. Now we've talked about some dark things. Okay. Yeah. Cancer's dark. Disability phases are dark, okay? But there's light, there's joy that we can bring into every minute of our life if we choose, okay? I know how hard it is. I do, I do, I do. I wake up every morning with tremendous chronic pain, and I have to medicate in order to even move out of bed. So but I do something that's very, very important. I become aware of who I am and I learn how to adapt. And please allow me to share with you what I have done. As a 100% permanently disabled veteran, I want to share with others how to live successfully with disability. And learning to use music and art as a healing is one of those ways. Take it away, Lori Elward, our co-producer. I'll go back to those resources later, okay, at the end, okay? All right.
I am really happy to be here today and to be part of this. Um, I love music. I love music. Music has probably affected my life more than any one thing at all. And I'm a singer, but if I wasn't a singer, I'd probably still be doing some kind of music.
Yeah.
I did some reading and found out that some things I knew that music helped with it releases endorphins and I mean it physically does things. It's not you don't have to be up performing on a stage. It's just the process of breathing and singing, even if you're just singing to to your computer or to Spotify or to Amazon or to whatever.
Oh, my dog.
Um,
Oh, my dog. I sing to my dog.
Right. Absolutely. A sing in the shower, whatever it is. It's the breathing and the way that it affects your brain. There's music enters the brain in a different way than anything else does, music and drumming. So it's just an
Oh,
amazing tool for a lot of things. But I didn't know this. It said that it also helps the immune system by boosting levels of the immunoglobulin IgA, which is a
mhm.
vital antibody that helps the body fight infection. I didn't know
Wow.
that. It also says it reduces snoring. Regular singing can reduce snoring by toning the muscles of the throat and palate. So,
Wow.
there's lots of perks here with singing other than it's just fun. I think doing it just because it's fun would be plenty of reason. But we want to look at some other things. And again, not talking about performing. Same thing with dancing. You like to dance? Put on some music, dance in your living room, dance while you vacuum. What I say each month is that our tendency is to say, okay, well, I don't have time for that. I've got to do the dishes. I've got to do the laundry. The kids need something. I got to go to work. I got to go to school. I have homework, blah, 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 blah. And we don't take the time to nurture ourselves at all. And we cannot give from a place of emptiness. We just can't. And
No.
and Dr. Jane mentioned this, we have to take care of ourselves. It's not that we have to give ourselves 3 hours, but 5 minutes, in your car, in the shower, whatever. That honoring that creativity and how important it is to us. I just can't express it enough.
May I interject also that in the same voice of what you're saying, because you've helped me to understand this too, is that with the guest that we have coming on today, who's actually an artist also, is that she uses art in drawing as a way of relaxing and addressing the anxiety in her life. So art is another way, but it takes a little bit
Absolutely.
more than for art than it does for music, right?
Right. Although you can get a box of crayons and some paper and you can do art, Art is anything you do that that expresses your creativity and, Play-Doh. I've played with my granddaughter with Play-Doh, so it's the whole thing is not making it too complex, simplicity. And if you're actually an artist and you've got paints and you've got easels and all those things, yes, absolutely. That's great. But you don't have to be Picasso or Monet to express yourself through art. So that's a really good point.
And
And
Lori, you do such a great job wrapping up this different abled artists and musicians. I know you have a guest, a beautiful guest for us today, who's actually one of our Dan members. And she just came on board with us. And I just really appreciate the way that you handle our musicians and artists that come on the program, and that we stay within the parameters of the only reason why we do this, my friends, please listen carefully, is that we want people to live successfully with disability. That's our whole premise, okay? Of being able to connect you to resources, to provide education for you for advocacy, and also to support you with mentors, okay? So we do all of this so that you can, what's that again? Live successfully with disability. Music and art will help you do that. Lori, introduce our guest for us, please.
Well, I just met Mavis officially yesterday,
Mhm.
and was very happy to meet her. And I'll just read this quote that she gave me here. I'm a 19-year-old girl who loves art in all forms. I love art because it allows me to express what I feel internally and cannot find externally without creating it. I just think that's such a great quote.
Woo,
And
that's
so I'm
fantastic. Yeah, I love it.
very happy to introduce Mavis and take it away, Dr.
Mavis,
A.
you're sharing something with us today. Hi, Mavis.
Hi.
You're sharing something with us today because when we met and we were talking together, you had mentioned something about, we talked about anxiety and stress levels, and you talked about some of the stuff that you do, especially the guitar. Okay, I knew about the art at the very beginning, and you do a great job with that. Um, but now I'm going to hear you for the first time sharing something that you wrote, actually, right?
That was my original plan, which I believe is in the next slide. I was gonna perform an original song, but I just feel like with the topic today, I just want to play something a little bit more um that connects directly to what you guys are talking about. My song, I can personally connect to, struggles with anxiety and, having to live with a, quote unquote disability.
Yes.
Um, but I just feel like the woman's song who I'm planning on performing, Adrienne Lenker, the song "Sadness as a Gift," just words
Hmm.
it more poetically, more precisely, and in the exact words that I would like to express to you guys, rather than the ones that make more sense in my head. If that makes
Yeah,
it's more
makes
of a
perfect sense.
it's a song that can be that can resonate with more people,
And you said
if
it's
that makes
sadness.
sense.
What is it called again?
Sadness
Sadness?
as a gift.
Sadness is a as a gift, and we talk about pain as a gift. So this is
Right.
very interesting that you're bringing that topic up for us because we may start using. We have another song that we use, "Steel in Your Spine" by Daniel Namad, that we use as one of our closing songs, and we may indeed use this one because it fits into some of the stuff that we teach people. Okay, about the gifts in life. Thank you. You can
Right, you're
begin
welcome,
anytime.
and thank you, Lori and Dr. Applewhite for having me on today. I'm excited to share this song because a lot of the people that I've talked to, they don't know who Adrienne Lenker is, and I find her to be such a musical genius with her lyrics and just everything. Her songs are just pure emotion. There's nothing else. A lot of her songs, they're just recorded kind of like the way I like to record my songs, just at her house, not in a recording studio, but you can hear everything in the background, like the birds chirping, and it's just more
Oh
very,
wow.
it just feels very raw and human, and
Well,
I really appreciate that out of music.
I think you're a genius. You're a genius. You said 19 years old, and here you are on the Differently Able Network meeting, helping people with disability to live successfully with disability. That to me says a lot about you as your character, your being. Okay, you're a very mature and wise young lady. Thank you for sharing. Go ahead.
Thank you. Um, would you like me to turn on my camera now?
Yes, please.
Okay.
And we have about 5 minutes. Is that about right? Does that give you enough time?
Yeah, that should be enough time.
Okay.
Can you guys see me?
Yes, can hear you
Okay.
and see you. Take
Awesome.
that deep
I
breath.
am in my car because I just needed to plug in my phone somewhere and also
Okay.
get air conditioning because for some reason it's 100 degrees already in February. So, okay, I guess I'll just start.
We're in
Okay,
Arizona,
so
people, in case anybody was wondering. We broadcast everywhere, but so we're in Arizona, and it is pretty hot here today, almost 90 degrees officially, I
yeah,
think. Yeah.
Okay. Like I said, the song is called "Sadness Is a Gift" by Adrienne Lenker. A one, two, a one, two, three, four.
Mavis, excuse me, honey, you're breaking up a lot.
I
So
am.
what I'd like you to do, if you don't mind, is to tell us the words, if you don't mind. Maybe we can hear you a little bit. Do you agree, Lori?
Yes.
Okay, yeah.
Or if
Let's
she
go
can sing
for
it
it.
a cappella, we might be able to hear it.
Yeah, because it's skipping
Do you
over a
mean the
lot.
speaking the words?
Yes. Mm-hmm.
Okay. Um, it's not gonna come across as,
Okay, just
but
do it the
I
best.
understand why, because
Yeah,
it's
I don't know. I
difficult.
don't know what will stop it from jumping like that. Do you know, Lori?
It's a setting she needs to do in Zoom.
Okay.
Mhm.
Oh, she
Yeah, you
needs
were
to
telling
do
me about
it.
that.
Okay. All
Yes,
right.
yes.
Well, let's just do the best we can.
Mavis, could you sing it without the guitar, just the voice, and see if that works?
Okay.
Yeah, I just put on original sound for musicians. Should I try it one more time and then
Okay.
I can just
Sure.
sing it
Sure.
Sure.
a
Yeah.
cappella?
Okay. Okay.
Okay.
Okay, hopefully. A one. Though you and I both know that there's nothing more to say. Chances shine, shining as the sun. The windowsill. You can run me someday, and I hope you will. We can say the sadness is the gift and still feel too heavy to hold. Oh, oh, oh. Still hopeful, and try to keep holding. But the spring to the winter, fireflies so frozen. Sitting on the windowsill. You can run me someday, and I hope you will. We can see the sadness is a gift and still feel too heavy to hold. The seasons go so fast, thinking that this one was gonna last. Maybe the question was too much to ask. I've been searching for your eyes. All I see is blue skies. And now
Okay. Woo! Okay, you better stop there, more Mavis. It really better stop there, Mavis. Okay, just having some technical difficulties here. Okay. Mavis? Hello, Mavis?
Yeah.
Mavis? Okay. Let's see. Mavis, are you there?
you hear me?
Okay? Yes, one of the greatest things that I thought about while I was listening to you there is something that you told me, that when you get this anxious feeling,
Can you hear me?
and I don't know, are you, you know, if you can share with people if you're, you know, if you wish what anxiety really feels like for you, I would appreciate that because maybe someone can associate. Okay, but you did tell me that when you get that feeling, that you usually land up going in your car, even in a break at work and playing your guitar. Is that right?
Yeah,
Yeah. Talk
yeah.
to, talk to us a little bit
That's
about
a
that
great
I
experience.
idea.
found um I obviously I can't just go to my car and just whip out a guitar whenever I want to or I need to. So a lot of the time I've noticed that sometimes we lose control of our thoughts, and especially in high stress moments where when the thoughts start to circulate, specifically negative ones that are causing the stress, even if your immediate surroundings are safe and fine, like if you're at work, for example, unless work is a stressful place, but for me personally, um, it was just work, but I found myself having, circulating negative thoughts that were affecting my work performance, and just singing songs that I had written out loud while at work, just to myself. And by only focusing on the lyrics and the tune and the melody and just focusing on singing, I was able to kind of overpower the other thoughts and have those go to the back of my mind instead of the front. Um,
Well, I can tell you, I truly appreciate what you're saying. And for those of you that are not familiar with anxiety, many times, I guess, one of the first signs for most people is a shaky feeling, a very shaky feeling. Would you agree? And I don't know, some people have sweaty palms, okay? Um, there's just a lot of things that go on with when you're
like
anxious.
feel really
Okay.
hot in my ears.
Mm-hmm.
Yeah.
Yeah. So, I appreciate what you're saying, and I hope that someone out there will get something from what you shared with us today. Thank you so much, Mavis, for being part of the Differently Abled Network today. My friends, we're going to close now. We're going to go back to that slide, please, to the slideshow. And I just want to close with a few things I wanted to say to you. Okay. Um, I don't know if Morgan is available, but we definitely want to thank our sponsors again. And we want to let you know that we'd like to do this more than just once a month, of course. But right now, even your donation of just your membership, which is $6 a month. Okay, general membership is free for everyone to participate in the Differently Able Network meetings. The other levels of membership cost because there is an involvement in your life of mentorship. But again, there is no way that anyone is ever turned away if they have a true financial hardship. We find a way to work through that so that we can help people out of crisis that are striving to help themselves. Thank you so much for joining us today. And there's so much that I wanted to share with you. But can I sum it all up by just saying I love you? Okay. And I appreciate that you took the time to be with us today. Excuse the technical difficulties, and I'll see you next month. This is Dr. Applewhite signing off.
Thank you, everyone.
Thank you.
Bye, everybody. Have a good and wonderful day and a good week.
Thank you so much. Thank you, everyone, for being here, and good job.